Good evening, everyone, and welcome to this episode of the Southpaw Podcast. Today, we are joined by Justin Hart. Justin, thanks for coming on.
Great to be with you, Jacob.
Awesome. Well, so Justin, just by way of introduction, I think everyone should know that you are a data analyst, and you are the founder of rationalground.com. Is that correct?
That's right. Yeah, we have a website that we've just recently put together with a bunch of folks who are very interested in all things COVID and even more interested in getting people back to work. That's kind of our main mantra.
Yeah, I'm pretty big on that. So I also wanted to kind of just give a little bit of background on how we connected. So I actually found out about you very early in the pandemic. I was trying to figure out what was going on because I run a business. I actually run a business that does vacation rental management, which is not the best business to be in when there's a major outbreak and all the airlines are being shut down. And I was kind of in a panic. You know, we have a team of almost, 20, 30 people, and we had to figure out what the heck we're going to do, to make sure our ship didn't sink because everyone was canceling and it was bad. So I'm a data guy. And so I was looking for something that was data driven, that kind of was explaining what was going on. And Aaron Ginn wrote an article, one of the first articles that I felt like was really well data driven early on in the Wall Street Journal. And then I ended up following him on Twitter, and then he was retweeting your stuff. And I was like, hey, this Justin guy seems to know what he's talking about. So that's kind of how I found you. And if anybody does want to follow you on Twitter, your Twitter handle is Justin_Hart, correct? Hart?
That's right. Yes.
Excellent. Well, I encourage everyone listening to follow you on Twitter because I think you have just great stuff that you're putting out there. So I really
thanks. And Aaron is my co-founder of the website, rationalground.com. So Aaron and I work very closely together.
Awesome. Very cool. Well, let's just, kind of get started. Tell us a little bit about, how you became so vocal on the whole COVID thing and how you kind of got involved in all this.
Yeah, I would say it started about 2 years ago, interestingly enough. I was with my family. I live down in San Diego, and we had a week vacation on the beaches there in Carlsbad, and we had rented just a great RV. It's actually a very affordable trip you can take there. And I had gotten a cut or something on my elbow, and so by the weekend I wasn't feeling too great. Wasn't sure what was going on. My wife, she chalked it up to man flu, which came just in time to take down camp, and so she was kind of miffed about that. But by Monday, it was pretty clear something else was going on entirely. Mm-hmm. I was checked into the hospital. I spent the next 2 weeks there with a staph infection. Staph is a natural flora that everyone has on their skin, but if it makes it into your bloodstream, typically through like a cut or something like that, an abrasion, it can really wreak havoc on your system. It did for me. I had pleurisy of the lungs. I had a bunch of stuff, and it was so fascinating to me that this tiny little thing could impact me so dramatically. So I kind of, started studying it from a lay perspective, and I love data sets, and the CDC has a bunch of great data sets. So it led for me, writing a couple articles on Medium about the links between obesity and behavior and county demographics, and it linked right into what is part of my job now, which is politics and doing analysis there. I was one of the digital directors on the Mitt Romney campaign.
Okay.
And so I have a background in politics, and I still dabble in it. You really can't get out of it once you're in it. and so, I'm always looking at those data-driven things. Like yourself, at the beginning of this thing, I had a couple clients. I serve as sort of a chief marketing and chief data officer for various companies. And my two big clients, one was out of Palm Springs. They do high-end golf excursions for baby boomers across the country.
Ooh.
And so that was dead.
Yeah.
And my second client was up there with you in Reno. She runs a high-end college application program for kids that are wanting to go to college. And we all know where that's headed. So those clients went out the door very quickly. And my third client was out of Colorado, which, interestingly enough, because I have a background in doing, like yourself, a lot of vacation stuff. They had a brand new startup sort of vacation club that was a startup for some of the people I knew out of one of my previous records, which was Surf Air, which was one of the founding members here in Surf Air, helping them get off the ground. So I have a background. And of course, like yourself, everything went to pot. Mm-hmm. So I got the time on my hands, not sure what to do. But I also have a very funnel-oriented mind. And one of the things I learned from the CDC and from their information on influenza is that it works very much like a sales funnel, or at least the numbers do. So, for example, in 2017-18, a very high flu season, you started off with about 44 million people who were probably infected across the 16 plus week major part of influenza. Then that about half of those people, about 22 million of those people, went to see doctors.
Hmm.
At some point, some of them are actually confirmed in labs, but we can talk about that later. But then 800,000 people of those 22 million, 800,000 had to be hospitalized.
Yeah.
And of between 40 and 100,000 people died of that ilk there, and either they died, of pneumonia, or they died of other issues, and so it became, this really interesting funnel as I had in my mind. In fact, if you take that number 61,000, which is the deaths, and you divide it by 44 million, that's where you get the 0.14. That is the overall infection fatality rate of whoever got flu and died of it. So
Yeah.
I looked at that number. I said, "Well, that's really interesting."
And that's
And then
that's a number. Just real quick
yeah,
on that note, I just want to make a quick comment on that. That was one of the things that, and people I still feel like don't understand the difference between the case fatality rate and the infection fatality rate. And that was something that was just driving me nuts, because everyone was thinking that, oh, like 5% of people are dying from this thing, and I'm like, no. Anyway, do you want to? Would you want to just kind of briefly go
sure.
over what the difference between those two are?
Yeah, and that made a huge impact because of a congressional hearing where Dr. Fauci appeared, and it turns out that what he was citing was the case fatality rate and not the infection fatality rate. So if I tell you out of 1,000 people that one person has got to die versus 10 or 100, it makes a huge difference. And the numbers that we were seeing out of China were outrageous,
Mm-hmm.
and the funnel didn't make sense. And that's kind of where I got my real interest to dive deeper. Now, the difference between a case fatality and a infection fatality is that a case is where you've actually sent something to the lab, or you can confirm that this person does indeed have the flu. Maybe they had a swab,
Mm-hmm.
and so that becomes a case, right? A confirmed case of influenza. And the CDC actually tracks that very distinctly across the country on a regular basis. Now, that would be like the 22 million number.
Yeah.
The number above that are the people that have the flu, but thankfully for a lot of us, we just kind of deal with it, right? The man flu is a thing, and so you get
Yeah.
it, you get sick, and my wife goes, "Just lay in bed for Saturday. I'll deal with the kids. You'll owe me big time. You'll take me on a date. It'll
Well,
be
yeah. I
great."
mean, a good example. So my wife and I, we actually already had COVID. Okay, we actually,
Oh, really?
we ended up getting it, and our symptoms were pretty mild. Honestly, it was the thing that sucked the most was isolating us, then isolating our kids for 2 weeks afterwards. But
Right.
but not to say that obviously the disease does affect other people pretty seriously. But the thing is I got tested. My wife never did, because we knew she had it. And so,
Right.
and not only that, I guarantee you there's all sorts of people out there who have it, don't know they have it, or have mild symptoms. Like I almost didn't go get tested because I didn't think I had it, because I only had really, really mild symptoms. And so again, I was one case, but
Yeah.
there was at least two of us, and maybe more. And that was when I was realizing that when people were talking about case fatality, I just immediately knew, you're talking about the wrong numbers here, people. The number of people that you confirm cases is not the number of people that actually have it.
I wrote an article in March called "The Coronavirus Dashboards Will Kill Us All Long Before the Virus Ever Will." And it's true. It's like, imagine if you went around life and you had a little buzzer to the back of your neck, and it went off every time someone got the flu. I mean, that's what's happening now.
Yeah.
Look, COVID is not the flu in this way, in that it is very challenging for certain demographics, and we have better treatments than we did definitely in March and April.
Mm-hmm.
But it was a as they call, a novel virus, and they're trying to understand it better. But I think the idea was, we understand where it's hitting, and that the overall case fatality rate, if you are under the age of 50, essentially,
Yeah.
this thing has zero impact on you. Okay, statistically, just it's almost zero. If you're under the age of 45, it's almost zero. If you're under the age of 20, it is bare bones. One example why influenza is not like COVID. If it were, there would be hundreds of teenagers dead right now, and hundreds and thousands of infants dead. because the influenza takes the younger cohorts a lot more seriously than it does than COVID does. So we can be thankful that it largely spares our youth.
Yeah,
So we've
and
learned
that's
a
something
lot
that
over
the
this.
data just bears out. I mean, at the end of the day, the treating us all the same is just, it's bonkers. Now, with that said, what would you say to those who, because the counter that I get to that when people do recognize, hey, look, the risk to someone who's under 20, for instance, you're more likely to die driving your car around than
Yeah.
from COVID. Like, it's not even close. And so I guess but they say, yeah, but they could spread it to more vulnerable people. What's your thought there?
Yeah, look, the asymptomatic part of this thing is not a big spreader. It never has been for these type of pathogens. Typically, it's spread, as people have said, over droplets or perhaps over aerosol. And so the asymptomatic is very large too. We know that compared to the flu, where you can make that assessment of maybe half of the people go to the hospital or the doctor to visit and see what's going on there, rather. But in COVID, we know that that could be a ratio of 10 of 1 to 9. That is,
Mm,
for every one person that has it, 9 of them don't even know they have it, right?
yeah.
And so it has a huge impact on some of the perceptions around this, which is you can't deal with it because it's asymptomatic. But the deal is you can't, since you can't really protect against that. The best thing is to protect against the most vulnerable. And imagine if we had spent half of as much energy and time and resources protecting the people that we know have a real impact. Those are above 65. And generally, the rule of thumb is if you're under the age of 65, the risk of dying of COVID is the same risk you face commuting to work. And if
Mm,
you're over the age of 65, it's slightly higher. It's about the risk of dying if you were on the job, if you were a professional trucker. So those are the risks that people need to sort of keep in mind and take into account. And we know that comorbidities, that is, people who have existing ailments, play a major role in that. And
hmm
there's an impact of butterflies and hurricanes with the shutdowns, right? If you look at the shutdowns, what impact they've had during this whole time, 50% of during the peak of the pandemic, 50% of cancers were not diagnosed.
Yeah, that's
And it's
crazy.
really interesting the stats came in, right? Because the way that the CDC and others work is we look over the last 4 or 5 years and we say, well, we expect this many deaths, we expect these many cancers, and we expect it to peak here in January and everything else. So they have it all sort of, these are our expectations, right?
hmm
And then all of a sudden we get through the spring and you realize, you know what, we have half as many cancer diagnoses.
Yeah.
And immediate thought you has, well, COVID cures cancer, which is not the case. Of course,
No.
sadly, what happens is people defer their cancer treatments, and it
Mm.
becomes very impactful. Um,
So my
one,
brother's a physician, and he and some others had written about this, or have been very, very strong about this is a disaster, because the amount of care that was postponed, because when they were kind of only doing quote unquote essential procedures. And my brother's someone who actually went and volunteered from the state of Nevada. It was only of a few volunteers from the state of Nevada who went to New Jersey during the height of the outbreak and was in the hospitals where they were losing people on their floor every shift. And so he was there. He's been on the front lines of this thing. And he even is saying, you guys, I've been on the front lines, and I can tell you the stopping of the care of, those cancer screenings like you're talking about and the other services, there are so many unintended consequences because we become so myopically focused on COVID that, we're going to cause more harm than we realize, kind of in the background, that isn't being counted on all the dashboards.
That's right. We call them sort of excess deaths, right?
Mm-hmm.
So every year, for example, every day about I think 8,000 Americans die. Every week, about 8,000 Americans die in nursing homes. So over the course of a month, about 40, I don't know if you know this, 40,000 people die in nursing homes and long-term care facilities. Typically, the average stay there is 3 months because they pass on after that. It is the last part of life that they're attended to there. And
Mm-hmm.
so those are sort of the expectations we have. And we know generally, what people die from. And so what we see is this large lump that comes here in the spring, especially because of New York, that where we have excess deaths that I think reach about 20% above what we anticipate each week. So each week you're tracking, you're saying, oh, okay, I see it's going above what we expect.
Yeah.
Okay. Now, when we break it down by age group, we see some interesting things. So, for example, we know that over the course of the pandemic, the core pandemic, about 20,000 people between the ages of 18 and 34 died beyond what we were expecting.
Hmm.
But we can only track about 8,000 of those to COVID.
Oh.
So there's another 12,000 people who died, and you can guess why. Here in San Diego, fentanyl overdoses are up 300%.
Mm.
In some areas across the country, suicides are up 145%. And I challenge people. I say, think about your own self. You may know someone who has COVID. Now I do. I know a couple people who have COVID. I don't
Mm-hmm.
know anyone who has died of COVID
Mm-hmm.
personally. But I'm sure there are people that do, and it's a tragic thing to take someone even in their late 80s. You'd like to see people live as long as they can to be with their family. But I guarantee you, a lot of people know someone who has been taken by cancer over these past 8 months.
Yeah.
And I know two people who didn't get the treatments they needed. I got a text or a DM over Twitter just the other day. It says, Justin, I'm in the OC, Orange County. Both of my elderly parents died this year, 4 months apart. Dad from undiagnosed glioblastoma in June, and mom from an undiagnosed artery blockage causing a stroke just last week. 4 months apart, they locked down and were afraid to go out at all, even for medical care. Our family is devastated and will never be the same. And so you can see it's a huge tragic loss when those things come up. It's butterflies and hurricanes, and in fact, I got some young kids, and a couple of them didn't get their immunization shots because just the doctor didn't seem an essential, right?
Yeah.
We had a miscarriage over the last few months. It was really, it was about 7 or 8 weeks along, 10 weeks along. So it wasn't. It was a very trying time for us, but definitely
Mm.
could have been worse. But you go in for the regular procedure to help with that, but she had to wait 3 or 4 days for her COVID test to come back. Meanwhile, the dead body of the fetus of the baby is sitting inside her, and it's a psychological
Mm.
bomb. It just
Well,
it's a
yeah,
bomb.
and I work with youth in our church, and it's been really interesting to me to watch this whole thing affect them. I mean, you want to talk about the worst possible thing you can do for a young man is to coop him up,
Yeah.
make him lonely and bored, and put screens in front of him all day. Like, what an awful recipe for disaster that is. And that's what all these kids are having to deal with. You're taking away all their sports, all their social activities, all of that. And they have the risk to these kids from the virus is so small, yet the risk of all these other things is going up and up and up. And that doesn't show up on the dashboards. I think you make a great point about the dashboards. The dashboards, it's like you're giving data, and that's one thing about data analysis that I appreciate from your perspective, is that you give kind of that broader perspective of data analysis. And someone who isn't trained in how to understand data, they're going to look at a case fatality rate and they're just going to think, oh my gosh, the sky's falling, or they're just going to see the numbers going up and up and up with cases, not recognizing that there's a huge difference in the number of deaths compared to cases. And so this lack of sophistication that people have, yet they're throwing data in their faces, it can very easily manipulate people into thinking things are much, much worse than they are.
Yeah. Now, in defense of our healthcare system, the CDC itself says don't rely on our data until it's about 2 years old. So you can imagine the scrambling they had to do when we said, no, we want this overnight, right? And I compare it to votes. I said, look, don't be surprised when you find a bunch of hanging chads and bags of Broward County votes, as it were, in the back of a hospital to make its way to the dashboard suddenly. So, like a perfect example of the data issues we face. If you often hear the refrain that we have 1,000 deaths today. Well,
Mm-hmm.
that's not true. We don't have 1,000 deaths today. What happens is the data lags to catch up. We haven't had an average week of 1,000 deaths a day since August 15th, when we had the huge rise in the Sun Belt there.
Mm-hmm.
We will probably get to 1,000 deaths a day in the coming weeks. We'll see how we go, but it hasn't been that way. What happens is that when you get a bunch of deaths, they layer into the past. So the CDC Weekly releases its new deaths. So last week, for example, they showed, well, on week 45, we show 966 deaths that we can log. And then on the previous week, you can add on another 1,300. And then you can add on to the week 43, another like 250. And they found deaths going all the way back to March, two or
Oh,
three deaths in March, right? And so what happens is, instead of those things coming right here, they layer into the past like a blanket across the timeline. And so I try to encourage people to think about those things. Like in Florida, they often say, well, we got 100 deaths a day. No, you don't. They actually go back several weeks. And what's happening is what we call death certificate matching, where they go through and they say, well, we have this guy in March and we didn't have the tests up and running. It looks like he might have been a probable COVID. We should probably put him into there. And let me tell you, they're highly incentivized to do so, especially at the hospital level, where they receive $16,000 for every COVID patient and
yeah.
$39,000 for every ventilator. Now, I'm not going to imply that doctors would do that purposely, but I guarantee you administrators will. In fact, you might think, if you're an administrator of a hospital and the government just shut down your most profitable parts of your business,
Mm-hmm.
you almost might be neglectful as an administrator if you didn't push to get as much money as you could to recoup what you've lost because of those shutdowns.
Yeah. I mean, the incentives are all goofed up when it comes to some of that stuff. And as you're saying, I agree. I don't think the doctors, because they don't have the incentive to do that, they don't necessarily control that part of it, but the administrators do. Now, real quick, what would you say are, right now, if you were to think of it, what do you think are the biggest misconceptions about COVID that are out there right now?
Well, first is the risk. There is an age stratification of the risk. And curiously enough, it goes right along with every age. So the median age of death in the United States is about 78, and the median age of death for COVID is about 80. And in fact, if you are 50, your chances of dying of COVID are about the same of dying of anything else. And so those are all the risks that come, and it goes up the scale there. Now, if this were the Spanish flu in 1918, and the median age of death there was 29, you can bet this would be a very different scenario. I'd be really scared and frightened for my kids. I'd be scared for this thing. But we know what the risks are, and they're actually very predictable. So I think having people understand their own risks, as I explained it, if you're under 65, it's commuting a car. If you're over 65, it's a professional trucker. Those are your general risks there.
And does that change with health? Obviously, I mean, if you're over 65 and you're unhealthy, does that does have an effect? Obviously,
yeah. If you're a woman that's 40 or under, you have a better chance of dying in a plane crash than dying of COVID, and you're healthy, right? And so these are all. I have some posters that I try to put up and try to get in those contexts there. If you're a kid, your chance. If you're a teenager or a high schooler, your chances of dying of COVID are lower than dying falling down the stairs.
And you have some of this stuff. 30. You have some of this stuff on your website. I take it that people can check all this out.
We have some of the resource pages there. So that's one. Is I would say know your risks. I think also one of the big problems that we have is our testing regime. So we use a very specific set of tests, which are called PCR tests. Mm-hmm. And what they do is they basically take a swab and they put a film on it. It works very similar to a pregnancy test, in that it's looking for certain DNA samples, and then that will light up a little sheath and tell you, oh, I see that the COVID thing lit up, so it looks like you have COVID. Mm-hmm. But to get there, it needs to replicate that DNA several times over. Now, if it takes you 35 to 40 times to zoom in and look for that COVID, that means you are not viral, you are not contagious. And we think that anywhere from 40, or as the New York Times reported, 90% of all our tests are not contagious. So we are quarantining people that are not contagious, and it's super impactful. So we're hoping for a full revamp of the testing regime. This is something we're going to be coming out with, a rational path forward in the next few days.
Yeah, and that's a good segue into kind of the other thing is based on the data that you're seeing and that you've posted for people on your website, what's kind of your thought on what is the rational path forward? Because obviously we are dealing with a pandemic. There are, a lot of people that are older that are getting this, that are dying. We want to try and control it. It's definitely serious, more serious to some groups than to others. What is that path forward that you think would be best if for policymakers?
Yeah, I think the as I mentioned, the knowing the risk. Two, retooling the testing. Three, we understand that track and trace is a reasonable approach to limiting the spread of the virus, and we must accept that the efforts have to be limited to identifying contagious people. I think also children should be the key focus here. We talk. That's another key factor of our plan, where we understand that to become proficient in any profession, you have that magic 10,000 hours that you hit, and you
Mm-hmm.
become a really good violist, pianist, acrobat, gymnast, or academic, right?
Mm-hmm.
Kids have lost over 1,000 hours of in-school learning, and that's nothing you can get back. So they're going to have a real detriment. We need to work for them, and I think that's one thing across the world. People are laughing at us because all their kids are back in school and ours are still at home. I think workers, one of the things that we need to sort of figure out is what is the appropriate sort of testing regime to make people feel comfortable at going back to work without having the haranguing piece of always testing things. We know that, for example, in Rhode Island, the number of retests, there's people who have COVID and now they're getting tested again, make up 85% of all their positive tests,
Hmm.
because a lot of systems, as we know, are not really there to dedupe, as we say. And the hospital here, I asked the inquiry and they said, nope, we don't dedupe them. So they go around testing people every day and it counts as a new case in their mind.
Hmm.
Those are really impactful things. And I think the main focus, though, is that we need to completely reset our mindset on what's called MPI, or non-pharmaceutical interventions. And these are the washing of hands, masks. These are social distancing. And what we need to do is have a mindset change where we're doing those things in a reasonable and sensible manner, where we can deal with people who are walking around with PTSD. And I wear a mask around just for that reason, because I don't want people to feel threatened or anything else there.
Mm-hmm.
From my own experience, the masks really probably don't help. And I don't think they bring a lot of measures of safety at all. In fact, a big Danish study just came out today to show there's really no measurable science to say
Yeah,
they
that
protect.
I
Yeah.
saw that tweet today, and that was really interesting to me because that's a big thing right now. Is that I thought it was so irresponsible of the head of the CDC to go out there and say that the vaccine, like a mask, is as good as like, what are you talking about? And the fact that people are acting like, I mean, for two reasons. One, because then people think, oh, well, you can do anything if you have a mask on. Like, go to the nursing home. It's not a big deal. You have a mask on. It's like, no, masks, like you're saying, I've looked at some of the data on it, and basically it's all kind of like maybe some, maybe a little bit, some,
Yeah.
and it's mainly if you have a really well fitted N95.
Yeah,
Like putting a piece
exactly.
of cloth on your face, it's like
No, that's not going to do anything.
it doesn't do anything.
But and I think one of the challenges that we have is really changing people's mindset. The main mindset we need to change is that you can't stop something you cannot see. You just can't. You can protect those as much as you can, but somehow we've got it in our brain that we can stop a virus. And so that's a tough mindset to have people swallow, because they want to control things, right? And
Mm-hmm.
politicians do too. But masks, for example, they become a scapegoat for politicians, because now the policymakers can wipe their hands and say, look, all of this would have worked if only.
If only you guys had worn the masks.
Jacob. But then you, Jacob, you can go, well, it wasn't me. It was my neighbor who wasn't wearing their mask, right? And so it becomes this awful blame game. And that's something I think that is hugely detrimental. Every epidemiologist is taught that you cannot blame the public for a viral pathogen pandemic that makes its way around. All you can do is protect as best you can. And so I think that's a mindset discussion we have to have. I think also we have to understand it's not a one size fit all, right? New
Mm-hmm.
York is as far away from San Diego as Moscow is from Gibraltar. And so we have a big country, and we need to understand that these things ebb and flow. So, for example, we knew there was a big northeastern push, and then all of a sudden everything lit up. Florida, Texas,
In the Sun Belt.
Arizona, California, all along the same latitude, and they all lit up at the same time. And so we know there's some seasonality that comes with this that we don't quite understand altogether. But these are things that we have to look at and understand that not all things work the same. That's why I think I'm proud of Governor Nome in South Dakota, who's like, we're not going to be putting in masks on everyone and everything else. There,
Well,
it's a
and that's something that when it comes to the political angle. So I actually, both my parents are actually elected officials. They're both in the Nevada state legislature. And in watching this, one of the frustrations that I've had watching politicians want to reassure the public that like, we're going to take care of this. And this is one of those things that I look at and I'm kind of like, I don't think you guys can take care of this. I don't think this is something that the government can fix the pandemic. People have this idea that the government can just do everything. And my thing is like, yeah, we can sort of do a little bit on the government level, but I really think the lockdowns, I really do think that their motivation, some people want to say, oh, they're all malicious and it's like these, big time power coups. And I think maybe there's some of that, but I think some of it honestly is just, they feel like they have to do something. Otherwise, the public is going to be mad at them. And so they end up, depending on what state you're in, depending on what your constituency is, you might decide, well, lockdown is kind of what the public wants because they want to feel like the government can do something about it. And I want to kind of segue from that into the lockdown discussion. What does the data say about lockdowns?
Look, lockdowns are particularly pernicious in that they've never been tried before, especially not on this scale. We've had isolations and quarantines. We have never quarantined healthy people before, right? I mean, just think about it on a logical point of view. We know that two of the major comorbidities or two of the situations which lead towards a higher risk towards COVID are obesity and lack of vitamin D. So the government shuts you inside your house, away from the sun, makes you eat takeout for 8 months, and then you're supposed to come out with your COVID-19, and make it out into the world, right? I mean, we all
It's
put on what
ridiculous.
they call it the quarantine 16, right? I mean, it's really bad, and we can actually put statistics around that. So I think the idea is that we know that lockdowns do immense harm, and every single study that's looked at it has come to that same conclusion. I think the WHO is encouraging, but it's addicting once you get into it, right? And so
Yeah.
these people just continue on down. And frankly, I think you alluded to it. There is a good portion of the populace which is like, just shut me down. I don't want to deal with this. I don't want, I don't want to catch anything there. It's amazing how many agoraphobics I have as friends and family, frankly. But we have to figure this out and try to get over it because lockdowns kill. They kill in immense ways. And you see it already across the country, and those lockdown deaths will continue. Here's the statistics from one of the great authors on sociology. He calculated that for every 1% drop in unemployment on a national basis, it will lead to about 40,000 deaths eventually because of overdoses, drugs, domestic abuse, and otherwise. Because when people cannot, when they face wreck and ruin in their lives,
Mm-hmm.
they do drastic things. You can see this already in Utah, where people are going to the health director's house and the governor's house and protesting. Right now, that's pretty extreme stuff. But you can imagine that they're feeling pretty upset about these things.
People are. I mean, it's been really interesting to me to watch the amount of anger and frustration and fear and just the amount of emotion this year that people are having. I mean, even my own mental health this year, like I can say it hasn't been good. And I've dealt with a lot more stress, and I lost. It's funny. Everyone was gaining weight during quarantine. I was on the stress diet when I had to lay off literally every single person in my business almost for a couple months, which was extremely hard on them. And then I feel awful. I'm talking about telling single moms that sorry, like you don't have a job anymore. And these are good people. And I actually I think I lost 12 pounds. And I'm kind of a skinnier guy myself anyway, and so that sort of, I don't know, it's just this myopic focus on, without considerations of the broader public health and public policy that drive me, and I think a lot of people it just drives us nuts because we feel the effects of it, and we know when we look at the data that I'm not at that high of a risk, and I know what people are, and I'll avoid those people.
Yeah, I think a lot of policymakers are kind of like Well, they're kind of like gamblers in Reno at 2 a.m. right at the slot machine. And they're just
That's not
they
good.
keep putting the coin in, thinking this next coin will do it. This next coin will do it. And then you see these masks. We have these great charts on our website. You can see where we delineate where the mask policy went in place, and then it just goes skyrocketing
Just
up. Right,
shoots right through it. Yeah.
they don't do anything, and so that's the challenging. There's no evidence that these lockdowns work at all, and there's plenty of evidence that they cause immense harm that's irreparable in many ways. And so I think I would encourage people to really look strongly hard. The only way that we get back to this is pushback. Unfortunately, here in California, I have a lot of people who just happily let the governor shut them down. So it's really difficult.
It is. It's wild, and you get both sides of it. I mean, some people are just absolutely livid, and other people just now. Granted, I will say when you do work for the state in some respect in some jobs, I've noticed that there's a very tight correlation between if a person had a paycheck coming in and how they felt about lockdowns. Because I can tell you that it seemed like every time that someone was like, "Well, we need to lock down," I always, I kind of would ask, be like, "Are you getting a paycheck right now?" Because if you're getting a paycheck, it's real easy for you to sit there and be like, yeah, let's just lock it down. I'm getting a paid vacation. It's like,
Right.
I'm not, and neither are my employees, neither is that single mom who doesn't know what she's going to do now. And so, I don't know, that kind of stuff just, it drives me crazy. Now, with that said, I want to get your opinion on this. Do you think there ever is a situation where if it gets to a certain level, that a lockdown could be advisable?
I think if the stratification of fatality was worse, and was disparate, right? Like I talked about the 1918 pandemic and how the median age of death was 29.
Mm-hmm.
That's scary when you have 20-year-olds dropping dead. That's where you close the schools. That's where you do those sort of things where you're like, wow, this may have an actual impact.
And you
But
say that
yeah,
because a broad lock, the idea is we don't need to lock down everyone with this virus because it doesn't affect everyone. We just need to essentially lock down certain groups or very much isolate them to the great or protect them to the greatest degree possible. But what
yeah.
you're saying is if it had a bigger stratification, there'd be more of a justification for broad scale
Sure,
lockdown.
and I think that's the real risk that we face here is that it's kind of a cry wolf moment, right? I
Mm-hmm.
mean, I know if this ever comes up again, I'm going to question everything the government does.
Yeah.
Like even now, knowing how the sausage is made, because I talk to lawmakers now, I advise lawmakers. So Rational Ground provides data analysis to some of the highest degrees here on state, local, federal levels. We provide alternate dashboards to different groups. I gave a webinar to folks there in Arizona, south of you there, for the mommy lobby, and we do this all the time, and so we have a good sense as to where people are with things. But I sense that if this comes back around, it's really going to make people question when there's another lockdown going, whether they'll buy into that or not.
Yeah,
I don't think we
absolutely.
should
And
ever. Yeah,
I know in some states it's going to be very, very hard. Like you're not going to, like here in Nevada, they're talking about locking down again. And I don't know. I wonder how people are going to react to that. I mean, it's going to be very, very difficult to get people to go back to that because now we kind of know. I think a lot of people are getting the data that like, hey, lockdowns don't really stop the spread of this thing very
right.
well
And
at
the
all.
lockdown never meant to stop the spread, right? If you remember, everyone was the original intent of lockdowns was to make sure that our hospitals weren't overrun.
Mm-hmm.
Now we come to find out that was the flatten the curve. The flatten the curve wasn't about deaths, and it wasn't about hospitals. It wasn't about cases. It was about we want to make sure that we can spread out the impact on our hospitals. Well, you remember the boats came on both shores and they were never
Mm-hmm.
used. And these things, I think the thing to remember, the people who predicted that every hospital would turn into a mass unit are
Mm-hmm.
the same ones who hate our healthcare system and want to turn it on its ear. Okay, so
Yeah.
those are intentions they have, which is but because we have a health finance problem, but as evidence for the way that we've been able to handle coronavirus, we have the best healthcare people and systems in the world. We have a financial problem that's usually caused because of the government, right?
Yeah.
And so it's going to be exacerbated. But again, for some reason, we have in our brain that the lockdowns that we have to cure cases, but that's impossible. You cannot cure the cases. You can only slow the impact on people that are most vulnerable. We still have, for example, pathogens and variations of the 1889 Russian flu, still with the 1918
It's not
and the
going away.
and the 1969 and the 2009 H1N. They're all with us. We have not eradicated any of them, and somehow we have it in our brain that we'll be able to do this one. It's a real pathologic lie that we've been telling ourselves. And
Yeah.
again, look, I want to be clear. I'm not a virologist. I'm not an epidemiologist, but I'm a darn good data guy, and I would never presume usually to insert myself into someone else's domain. But they sure seem to be inserting themselves into my domain and my church and my kids' education and my business and my health. So I hope they'll forgive me if I check their math, because I've checked it out and it's wrong.
Yeah,
And
and
so that's where I come.
that was another thing I was going to say, because people may listen to what you're saying and say, "Oh, well, you're not a doctor, you're not an epidemiologist, therefore your opinion is meaningless." What they don't realize is that data is data is data. That was one of the things that when Aaron put out his article, that's one of the things he talked about in it. He said, "Look, data is a universal language, okay? And it kind of, you can analyze it, and there's good data, there's bad data, and there's ways to check all these things." And so that was when that really, piqued my interest, because I'm like, this is what I want. Like, I don't care what the opinions are of people with various motivations. What I want to know is, what do the numbers say? What is the probability of me dying if I get coronavirus? What is the probability of my wife, my parents, everyone else around me? And as soon as I know that, then I know the risk. And then, as a free person, I have the right to modify my behavior according to my risk tolerance. And that was what I wanted to find out. And it's the data guys who are going to actually have that. Not necessarily, a doctor will understand really well the way it affects your lungs and all that. Like, I would never even comment on any of that. I don't know anything about that. But when you start playing in the realm of data, I think that we need to stop listening to people that aren't the data experts. We need to listen to the data experts.
Well, and it's policy people too. So, for example, what we've done basically is we've given the country over to doctors, right? If I gave my life over to my doctor and say, "You tell me how to live my life," it would be really boring. I'd be eating really boring foods. I wouldn't be going anywhere. There would be all sorts of tests and prods and things to be aware of. I think that's, doctors are risk averse, right?
Yes.
Dr. Atlas, for example, is not an epidemiologist, but he has he has deep experience in public policy, applying medical information to that, right?
Yes.
And that's what's needed right now. Unfortunately, it looks like those are out the door. He's got 2 months left before the governor, before President Trump. Maybe not. Who knows? We'll see.
Yeah.
Just read about this tonight, right? So
yeah, I was going to mention that right now, one of the things that's going on, obviously, is, like Dr. Fauci, and I think Dr. Fauci is good for certain things. I'm not like one of these Fauci's like this evil person, whatever, but everyone has their lane that they're an expert in. And when you're talking about public policy, you don't just have to take into consideration health. You have to consider economics. And I'll tell you what, Fauci's not an economics expert, and he doesn't know what the effects of certain economic policies are going to be on tons of people's lives. And not just, people have this idea of the economy. It's like, oh, well, you're trying to kill grandma to save Wall Street. It's like, no. Like, the economy has a direct effect on public health. Go to places and look at the public health in countries where the economies have collapsed. Look at what happens when drug addictions go up, when suicide. I mean, these things have massive impacts, and we need to make sure that, like people say all the time, the president says it, that the cure is not worse than the disease.
Yeah, when you really get down into the sewer, you find some really interesting things. So literally, like in certain parts of the country, they've had to retool and restaff a bunch of people into sewer systems because they were counting on a certain amount of people throughout the week flushing in buildings, right? The reason why toilet paper went out of stock so wrong wasn't because of a rush on toilet paper. It was because, how do we put it? People do about half of their business at work, right? And
I didn't think of this. This is actually a great point.
So someone who knows paper products was telling me this, that the type of product that you put out when you put it on a big ream and a big pallet and you bring it into the IBM building and then it's distributed to all the toilets, that's a very different process and workflow than we've got to now make up for that by putting it all in Charmin again,
That is a
right?
new workflow, that's for sure. You got
So
you got a
you
different
think about that
workflow there
workflow,
for all
right?
of us from
It's
home.
distinct and it happens all. So when it comes to the sewer, things change dramatically, and so
Well,
butterflies
it's
and hurricanes.
it's really odd, and it's thrown off all the normal rhythms. My father owns a plumbing company here in Reno, and they got super busy when COVID hit. Super busy. And we all of a sudden we realized why is because everyone was stuck at home using all of their plumbing more than ever, and they were also a lot of them were doing home improvement projects while they were at home, and so they
Right.
were drilling drills into the wall, hitting pipes, and doing all sorts of other funny things.
Well, look, I mean that's the lighter side of it. The darker side of it are things that we don't want to face. Like the University of Michigan said over the course of uh, quarter 2 and 3, we're likely missed 250,000 cases of domestic abuse because typically those are discovered by interactions that the children have outside at school, at church, with friends
Mm-hmm.
who notice where that bruise come from. None of those were found. Imagine the dreadful impact these kids face now in that impact. So butterflies and hurricanes. If you can't mess with the sociology of a world and expect that it's going to go there. Look, the life of an 80-year-old man here in La Jolla, California, is extremely valuable. But is it any less valuable than the hundreds of children that are going to die in African countries because the workflows to provide food for them are shut down now? Are shut down.
Yeah.
A lot are shut down. It's dreadful. The type of impact that we think we have when we play, chess with some type of new NPI, as we call it, non-pharmaceutical interventions.
Yeah.
They don't work that way.
The unintended effects of totally disrupting the normal rhythms of human interaction and human economies and all of that. The fact that people don't account for that is just ridiculous. Now switching gears a little bit. So what do you think, ordinary people who are listening, what would your advice to them, what would you say they can do or they should be doing?
I say you should share with them. I always say the 50-50-50. 50% of cancer diagnosis missed, 50% of chemo treatments missed for people who did have cancer, and 50% of immunizations missed for kids. These are things that people can relate very quickly to their neighbors. Say, I get what you're saying about the lockdowns, but have you heard about this, right?
Mm-hmm.
And so I would say we need to share those emotional stories because I would say some of your listeners probably know someone who has died of COVID, but I guarantee you every single one of your listeners knows someone and themselves who's been impacted by the lockdowns, right?
Mm-hmm.
So those are stories that need to share and get out there. The data will only convince people if they're willing to be convinced around these things, and they speak in emotional terms because it's a very emotional and physical subject, and so we may need to counter that. You may need to share some of those dreadful impacts that are having. My 12-year-old daughter, she came up to me the other day, and they go to a private school, luckily, but even then, it's very locked down. The strictures are there. It's a little crazy. And the challenge that you have is she goes, my friends and I, we plan our bathroom breaks together because it's the only time we can take off our masks and hug each other because you can't touch each other otherwise, right? And so you have this whole range of kids who have never. My youngest daughter, I have a bunch of batches of kids.
I was about to say, I got word that you have quite a few children. How many kids do you have?
Well, I've got one batch that's I have 7 kids altogether.
That's awesome. You're an American hero.
Yeah, and my youngest is nearing 2 years old, and we just put her into preschool, and I don't know that she's ever actually seen the face of her teacher, which is hugely impactful.
Yeah, that's
Who's got to learn social interaction. It's dreadful. It's dreadful what we've done to our children.
Well, my boys, I have 4 kids. I'm not quite on your level yet. Maybe one day.
2 are step kids.
although I am one of 8 kids, so I know about big families. So no, my kids, so they play youth soccer, right? And first of all, they have these absolutely insane rules where they put all the parents in like this one area, which is the weirdest thing. It's like away from the kids. I was like, why are we? Anyway, that was beside the point. I I noticed one day that my boy Oliver was really playing a lot better than he normally was, and I was really excited about it. And I ended up finding out why. The whole school year at their school, luckily they're in school, first of all, they wouldn't let the kids play with balls at recess. And so they weren't playing soccer. Now, finally, they got approval to allow the kids to play soccer on the playground. And all of a sudden, my little boy is developing this athletic skill and is actually showing it like on the field because he's out playing with his friends at recess every day at school. And I was thinking about it and I was like, think about that. Little things like that. And with little kids especially,
Yeah.
the development that happens in a 6-month period for a kid
Step.
it's huge. Like to miss
My,
6 months of your development as a child is a big deal when you're 6 years old.
Yeah, my 3-year-old burst into tears on Friday because we quickly realized that the county here in San Diego, because of Governor Newsom's rules, was moving into the purple tier, whatever that means. But we knew what it meant for her ballet class, that it was canceled. She could not go to her ballet class, and so she's in tears. If my kid wants to become a ballerina, she may have missed her shot. I don't know. These are hugely impactful steps that will have ramifications for generations, and they're completely unnecessary. And so I would encourage people to share their stories, share those things that really do impact their lives, because there are numbers behind all of these things, and we need to get them out there. And I think that's the only pressure that our politicians understand is sometimes emotion, but we have the data to back it up too. So
absolutely, and that's one of the reasons I wanted to have a conversation with you, was because I do think that those emotional stories combined with the data as well to show people, hey, this isn't just an emotional story. By the way, there's no reason that our kid can't be in ballet class. Like the risk is here's the data. I think the combination of those two things really can. I think that is the narrative that needs to get out instead of the constant media fear mongering that's going on. And I think that your website specifically with Rational Ground and some of the stuff that you're just tweeting out on Twitter, again, I'm going to encourage everyone to follow you at Justin_Hart, Hart, on Twitter, because that data that you're putting out, I think, helps people realize that they don't need to be afraid. And I think the more people recognize that they don't need to be afraid, the better our results will be.
yeah, we need to overcome the fear and quash the fear mongering, because it's high tide that we get on with our lives, and it's going to take a little bit of major pushback on those powers that be. And this is nothing new. Nothing is new under the sun, as they say, right? 400 years ago, Europe faced a real plague where 1 out of every 2 people who contracted the plague died, right? In Milan, Italy, there grew a fascination around foreign powers that might be infiltrating the city, and as they call it, anointing or washing the walls with plague-infested rags to promote the pandemic. It was probably unfounded, but it became a very, very concerning thing. And so everyone became suspicious of everyone else. At one point, an old man in church was brushing off with his hat the bench that he was going to sit on. Someone from a distance shouted, "He's anointing the bench. He's washing the bench." A crowd pounced him, brought him outside, and nearly killed him. That's the kind of real tension that our policymakers have created. And so one of the authors of that piece, who went back and looked at all the journals from that time, he said fear of that sort of anger and that sort of vitriol far outweighed the actual risk of the virus. So nothing is new there. This has all happened before. The mask fanatics were there in 1918. You can go back and read the clippings on how a couple years later they came to realize, okay, masks don't really work. But we're at it again. So nothing is new under the sun. It's been going on like this for many hundreds of years. And we have to understand that our bodies are built to resist these sort of things and to become better because of them. And when you ignore that, you're just delaying the inevitable. You're
Hmm.
delaying what's going to be a dramatic impact on a large piece of society. The lockdown deaths will continue, and it will be dreadful.
Yeah. Well, Justin, we're getting low on time here. So I think we'll kind of wrap things up. I want to thank you for coming on, but I want to give you one final chance. If there's anything else that you want to let people know before we sign off.
No, I think just be positive, right? Let's keep our spirits high. There are times when it's going to be down, and you're going to see those stats, and they're going to worry you. But just know the data is on your side when you oppose lockdowns and you avoid the fear. And that's my goal, is to quell COVID fears one chart at a time and one story at a time. And so hopefully you can share some stories with me. Find me online there. Would love to have you.
Awesome. Awesome. Well, I encourage everyone again, follow you on Twitter at Justin_Hart, Hart, and to visit rationalground.com. Educate yourself on the data. This is good data that Justin's putting out. And I think the more people are familiar with it, the more rational they can be. And hopefully, like you said, we can keep our spirits up, because I do think that there is reason to be optimistic. I think there's a lot of fear mongering, and appreciate all that you do with that. So thank you very much for coming on.
Good luck on the podcast. Super excited to be part of it. And we'll talk to you soon.
All right. Take care. Thanks a lot.